everyone. Happy Wednesday. Sorry I'm a few minutes late, but you know me and technical difficulties sometime. But thank you for joining. Anyone who is joining tonight, if you could hit live for me, comment live, or comment replay so I can know which one you're at. Everyone I'm not able to see join in, but I do see Rita is on. Thanks for joining, Rita. For those of you who are new to the group, I'm Dr. Monica Tillett. I'm a doctor of physical therapy, and I own New Direction Rehabilitation and Wellness, and we're dedicated to helping our seniors live their best life by helping them avoid falls and stay strong and keep their independence. So I started this balance group to help people with their balance, and vertigo is one of the main things that causes people to lose their balance. So thanks, Mom, for joining in. Hey, Shelby, thanks for joining. So let's get right into it. All right, so you hear people talk about vertigo, you hear people just say dizziness. What is it? What's the difference? Vertigo is brought on by getting yourself in different positions, and you either feel yourself moving or you feel or feel that the room around you is moving. So it's almost like you're in like this another world of just being unsteady, distorted, and dizzy. But just regular dizziness, if it's not vertigo, can just sometimes just be brought on by, you know, not drinking enough water or some of your medications, and there's no real rhyme or reason to when you get dizzy. But with vertigo, most of the time there is a rhyme and a reason, and it's typically doing the same types of movements. And most of the time those movements are like turning the head left and right, or looking up and down, going from sitting to standing, or even going from a laying position to a sitting position. So those are the main movements that can trigger the dizziness in vertigo, if it's related to pure vertigo. So why are those movements causing the dizziness to start? Well, one reason is that there are little crystals inside of our ears, and some of you may have heard maybe your grandparents or great-grandparents say, boy or girl, you got rocks in your ears, you know. And literally we have rocks in our ears, and they're called canaliths, and they're just little tiny crystals that are inside of our eardrums, so to speak, but they have a place. And when they get out of place, they start floating around in some of the fluid in our ear. That's when the dizziness starts, and that they don't start to move until we move our head, because that's when our balance system inside of our ear is activated. So that's why those movements cause the dizziness, okay? And then sometimes vertigo, you know, it could be caused for an unknown reason. I myself experienced vertigo one time, and I'm like, this is awful. I never, ever want to experience this again. And I couldn't figure out why it was there. It happened one day for about 6 hours, and then it was gone. But some people have, you know, ear infections, or maybe they have hit their head, and that can trigger episodes of vertigo. But know that, you know, once it resolves, there is a possibility that it could come back again in the future. So we're going to talk more about that as we go through everything. Hey, Miss Delphine, thanks for watching. Hey, David, thanks for joining in. David is my business coach, and it always makes me feel so good when he takes the time out of his busy schedule to see what I'm up to and to offer his support. So thank you so much, David, and everyone else who's on. All right, so let's talk about how vertigo is diagnosed. How do you know you have vertigo? You've determined that you're dizzy. You've determined that certain positions make you dizzy. What do you do now? All right. So the first thing you can do is to go to your doctor and let them know what's going on, and they may run some tests and see, you know, make sure your blood levels are okay, your blood sugars are good, and ask you a few questions. And then most of the time they will maybe refer you to a physical therapist who is trained to treat vertigo. So I am a therapist who has been trained to treat vertigo, and what I do once you come to me is I will get you laying down on the bed, and I will put your head in all these crazy positions, and that's going to tell me if you have vertigo and where the vertigo is and the type of vertigo that you have, okay? Then I'm going to look at your medications. I'm going to take your blood pressure. Actually, I do this first before I get you on the bed in those crazy positions, but just to make sure that other factors are not causing the dizziness. So once we determine all of that, then I take you through what we call a vestibular rehabilitation program, and that consists of me putting your head in more crazy positions to get those canalifts or rocks back into place, and then I will give you eye exercises to do, and then we'll actually be putting you in the different positions like standing up and turning your head and all those things that cause the dizziness. We'll be doing those things. And I want to show you one exercise that I like to start people with. And I think for the next week, I'm going to post different exercises. I'm going to call it a vertigo home exercise program. So you can have some resources for yourself to try and work things out at home, and if that doesn't work, then you know you can contact me or another physical therapist who's trained in vertigo, and we can actually get you into the positions and tell you exactly what you need to do. But in general, this is just a basic exercise that you can do. So you're going to start with sitting up on the side of a bed, okay? And you're going to turn your head to the left. Then you're going to lay down. You can still see me good. You're going to lay down, and you're going to make sure that your nose is pointed to the ceiling. If you get dizzy, you're just going to wait till the dizziness stops. Then you're going to come back to the sitting position, and you're going to turn to the other side, and you're going to come down. Hopefully you can still see me, and make sure that your nose is still looking at the ceiling. If you get dizzy, wait till the dizziness goes away, and you're going to come back up. Okay, so it doesn't go that slow, but what you're going to do is you're going to do cycles of these. You may do 5 cycles, 6 cycles. You're going to go, the goal is for you to get to 10 cycles, but if you feel like you're going to throw up on number 3, then that's when you stop, okay? So I'll show you that again in a faster pace that may be the pace that you would need to do it in. So look left, lay down, dizzy, I'm dizzy, I'm dizzy, I'm dizzy, it's gone. As soon as it's gone, pop back up, look to the right, come down, look, oh, I'm dizzy, I'm dizzy, I'm dizzy, and come back up, and then you're going to keep doing that, okay? And you're going to try and pick that pace up, okay? So it's good to note that there is, again, the right side. If you get down on the right side, that dizziness may last a little bit longer than if you got on the left side. So just whenever the dizziness is gone, sit up and just keep going. And remember, that is probably going to make you dizzy. And just know, in order to treat vertigo, you know, we actually have to make you dizzy. We have to provoke that dizziness, because that's the only way to get that system inside of our inner ear back on track and working as fast as it needs to work in order to keep you from being dizzy. So this vertigo, again, is a broad subject. There's a lot in it, so I think that the best thing to do is to post a series of exercises and show you what to do, so that way you can have them to look over. All right, a couple of more things that I want to go over is, one, if I start treating a patient and we've gone through maybe 4 visits or sometimes five visits, and the dizziness is still the same, there's no real change, then I always refer them back to the doctor, because there are more tests that need to be run. So a good example is patients with diabetes. Some people know that they have diabetes. Some people do not know that they have diabetes. And I have had it where people think they have vertigo, and they may demonstrate all the symptoms. Their eyes may be jumping around, called nystagmus. They may get dizzy, turning their head or standing up and down. But when they go back to the doctor, they find out that they have diabetes and their blood sugars are extremely high or extremely low, and they have to get on medications to help control their diabetes, and then that's what takes away their vertigo. So just know that it's not a clear-cut thing. You do need a professional to guide you through it and to take a look at everything. And also, like I mentioned earlier, hydration is so important. Stay hydrated. Drinking water, trying to drink things that doesn't have a lot of sugar in it, and coffee does not count as hydrating yourself. So try to drink as much water as possible. All right, so to wrap it up, first of all, comment makes sense. If this makes sense to you, or if you have any questions, please comment in the comments any questions that you may have while I'm going over this last little piece, and then I can address any questions. But I want you to think of these 5 questions, and I will post these again as well, to see if you need to seek help for vertigo. The first one is, does looking up or looking down cause dizziness? Okay, or even looking side to side, does that cause dizziness? Okay. Second one, when I'm getting in and out of the bed, you know, I'm laying down and I come to sit up and I'm like dizzy, dizzy, dizzy. Is that causing dizziness by going from a laying to a sitting position? That's question number 2. The third question is, if I move my head fast, you know, just quick head movements, you hear a horn honk and you're looking, you know, or someone calls your name and you look. If that makes you dizzy, then, you know, that could be a possible, you know, indication of vertigo. So think about that. And then number 4, does bending over cause dizziness? Okay. And then the last one is, and this is almost the most important question out of it all, is the dizziness constant? Is it something that happens almost the majority of the day, or for, you know, a few hours, whether you're sitting, standing, moving around? Is it always there, or is it just there sometimes, which is during those head movements and when you're standing up and laying down and sitting down? So think about the span of the dizziness, because if it's a constant dizziness, that's an indicator that something else may be going on. Okay, so again, thank you for joining me. I'm not trying to take you back to my whole year of PT school or anything like that. I just wanted to give you a brief overview, and I hope it was helpful. And all right, I don't see any questions. It looks like things are making sense. And David, we'll make sure we get those rocks out of your ears. But thanks again, everyone, for joining, and I will see you next week.